I'm Jo Reynolds. I'm a Research and Evaluation Manager and I work for Good Things Foundation. So at Good Things Foundation, our mission is to fix the digital divide for good. And by that, we mean we want to enable everybody to have the access and skills and confidence that they need to be digitally included and to be able to engage with the digital world as much or as they need to or want to. And we work with a network of over 4,000 community-based organisations around the UK who help us to deliver a range of support and services. So that's things like access to digital skills, learning, access to mobile data so that people can get online, and also access to digital devices to be able to get online as well. And we also, as an organisation, campaign for improved digital infrastructure more generally to raise awareness of the barriers that people face in engaging with digital services and some of the inequalities that sit around that. From a digital perspective, I think there's still this kind of myth that digital exclusion equals older people, equals people who perhaps don't have the skills, have never been brought up using a computer or a mobile phone, and perhaps who aren't very motivated to get online. And certainly there is a population that are in that category and who do need support and help, for example, accessing health services and lots of other things. I think if we're thinking about maternity services, we've got to recognise that actually there's a lot of younger people who are facing barriers to doing more online and therefore might be facing barriers to engaging fully with maternity services where those services are increasingly using online methods. 1 in 14 households in the UK don't have any access to the internet at home, and this includes households with children, it includes younger people, it includes people who might be accessing maternity services, for example. So I think it's really important that we don't just assume that if, for example, a woman is accessing maternity services, is younger, isn't in that kind of older age bracket, that we don't automatically assume that she has the ability and the access to do everything online. And you also need to understand that digital exclusion is kind of it's a murky category. It's not a kind of easy in or out. So somebody might have a mobile phone and they might get their mobile phone out in a health consultation, for example, but it doesn't mean that there's enough memory or it's even configured well enough to be able to, for example, download the NHS app or engage with, for example, a video consultation. And also we can't assume that if somebody has a phone or has a laptop or a tablet that they're actually confident enough to use that and to access information digitally. It's really, really important when either designing new health services or when health care providers are engaging with patients, that they really take the time to understand what might be the barriers to somebody accessing an increasingly online health service. And that might be around digital, it might be around other things, but we can't assume that digital exclusion is only looks like one thing. It only looks like older people who don't have a computer. It can be many different things, and people can move in and out of digital inclusion and exclusion month by month, depending, for example, on if they've got enough money to pay for mobile data that month compared to the next month. We know that there are some great overlap between people who face digital exclusion and people who face health inequalities and inequalities of access to healthcare. So things like deprivation, well, so people who cannot afford to pay for mobile or broadband data connectivity, people who cannot afford to pay for a suitable device that will enable them to access health services. So deprivation is really, really key. People who may struggle to speak English or who may not be confident in reading English or interpreting it, we know that those people have faced more barriers to accessing healthcare, including maternity services, and we know that they can struggle to engage with digital. There are online translation tools, but it's also about a confidence to feel like you really understand what's being asked of you and you really understand what you need to do to be able to access that service. And literacy and confidence and language are kind of all bound up together, and that can be a real challenge. Lack of trust as well We know that people might be really confident doing certain things online, but they absolutely are reluctant to input their personal data, whether that's online banking, whether that's filling in an official form. And that lack of trust can come from lack of confidence in digital generally, but it can also come from being somebody who's in a marginalised community, somebody who has experienced, or their community has experienced challenges which mean they are suspicious or fearful of institutions, and therefore they might be really, really reluctant to put in personal information online where they don't know where it's going. It's a faceless system. They're not interacting with a nice, friendly person, and therefore that lack of trust can really be a barrier digitally. If somebody is already facing inequalities in access to healthcare, and then they're digitally excluded, or they struggle to engage with digital, when digital and healthcare come together, that means those inequalities just compound each other and have the potential to make the situation even worse for people who are already marginalised and already facing those inequalities. There are lots of frameworks available. There's a newish NHS digital inclusion framework that are really useful guides for when new services are being designed or aspects of services are being designed. And I think using those frameworks, there is a lot of research and guidance out there already saying what good practice should be for designing digitally inclusive health services, bringing in the lived experience voice of people who have or still struggle to engage digitally, to really understand what those range of different problems might be and to what extent that the service could be designed to accommodate them. Always having a non-digital option is really important, and for people to understand how they can use that non-digital option. So digital first is often something that we hear, but it can't be only digital. There must be a valuable and accessible option for people to access the same services without using digital. Sometimes the staff themselves are not particularly confident around digital, or they might be able to do what they need to do, but they may not be very confident in supporting somebody else, a patient, to understand how do you use this, how do you use the NHS app, how do you connect to a digital consultation. So upskilling and building the confidence of healthcare staff and providers, I think, is a really important part of the picture as well, so that they feel they can understand what needs to be done, and they can support the patients to feel like they're confident enough to use the resources as well. We have Good Things Foundation within our network. We have a number of maternity services and other healthcare organisations who have joined our network and who are accessing the resources that we can offer. For example, we have something called the National Data Bank, which is providing free SIM cards and data vouchers, mobile data vouchers, to people who need them. And we are working now with an increasing number of healthcare organisations. They join the National Data Bank, and then they can give out mobile data vouchers and SIMs to the people they're working with to ensure that they have the access so that they can use the apps or engage with digital services.